related to A. Hyperventilation, B. Obstructive sleep apnea syndrome, C. Congenital central hypoventilation syndrome CCHS, D. Obesity hypoventilation syndrome. And the correct answer is C. Congenital central hypoventilation syndrome CCHS. Ondine's curse is also known as congenital central hypoventilation syndrome CCHS. It is a rare condition where the body's automatic breathing control doesn't work properly, especially during sleep. This can lead to shallow breathing or even pauses during breathing, causing low oxygen and high carbon dioxide levels in the blood. Treatment usually involves using a breathing device during sleep to support breathing and prevent complications. Which of the following stimulates respiration? A. Acetazolamide, B. Estrogen, C. Testosterone, D. Norepinephrine. And the correct answer is A. Acetazolamide. Acetazolamide stimulates breathing. Most malignant mesotheliomas are related to exposure to A. Silica, B. Asbestos, C. Benzene, D. Carbon. And the correct answer is B. Asbestos. Malignant mesothelioma is a cancer of the thin tissue that lines the lung, chest wall and abdomen. The major risk factor for mesothelioma is asbestos exposure. Pallas sign refers to A. Focal oligemia, B. Peripheral wedge-shaped density above diaphragm, C. Enlarged right descending pulmonary artery, D. Enlarged left descending pulmonary artery. And the correct answer is C. Enlarged right descending pulmonary artery. Pallas sign is a clinical sign in which an enlarged right descending pulmonary artery is seen on the chest X-ray in patients with pulmonary embolism. It exhibits as a sausage appearance on X-ray. It is named after Italian radiologist Antonio Palla. What is the primary characteristic of TC syndrome? A. Bilateral chest pain without swelling, B. Swelling of the vertebral column, C. Chest pain and swelling at the costochondral junction, D. Generalized swelling of the chest wall. And the correct answer is C. Chest pain and swelling at the costochondral junction. TC syndrome is when your joints near your ribs get swollen and painful. These joints connects your ribs to your breastbone. This condition affects the costochondral junction, which is where your ribs meet your breastbone. Pectus carinatum is also called as A. Hydrocephalus, B. Kyphoscoliosis, C. Pigeon breast, D. Barrel chest. And the correct answer is C. Pigeon breast. Pectus carinatum is a deformity of the chest wall in which the breastbone and ribs are pushed outward. Pectus carinatum is sometimes called pigeon breast because of the bird-like appearance of the chest. Pleural effusion itself is A. Dyspnea, shortness of breath, B. Pain, C. Cough, D. Hemoptysis. And the correct answer is A. Dyspnea, shortness of breath. Malignant pleural effusion refers to the accumulation of fluid in the pleural space due to cancer. Shortness of breath is often the primary symptom because the accumulated fluid puts pressure on the lungs, limiting their expansion and impairing breathing. Other symptoms may also be present, depending on the underlying